Okay. I think people will probably still trickle in, but we're going to go ahead and get started. Welcome to July's webinar. Super pumped to talk all about pediatric pelvic health. Now, my name is Jen Morgan. I own Centrality Wellness. I also am a pediatric therapist for pelvic health, and I also treat adults. This webinar is going to be given by Janelle, who's also one of our other pediatric pelvic health specialists, which is going to be amazing. I'm going to let her take it away in a second. Couple of housekeeping things. Let the questions roll in. So please drop them in the chat. I will be keeping an eye on that chat the entire time. We're going to make sure that all of them get answered at the end of this presentation. And then if there's anything else that pops up, the recording will also be sent to you either this evening or tomorrow morning, depending on how fast I can get it uploaded. And you can always email us questions at hello@centralitywellness.com as well. With that being said, I'm going to go ahead and I'm going to turn it over to Janelle, and I'm going to be manning the sticks over here.
Perfect. Thanks, Jen. Hi, everybody. Thanks so much for joining us. Tonight, we're going to talk all about pediatric pelvic health. As she said, I'm Janelle Kleiner. I'm a pediatric pelvic health specialist as well as adults. I've been trained in the Herman and Wallace course. I've also been trained in the pediatric pelvic health courses, and I have some visceral manipulation training as well as a functional nutrition certificate. Our objectives and goals for tonight. So first, we're kind of going to introduce what is pelvic floor therapy as well as pediatric pelvic floor therapy. What are some common signs of pediatric pelvic floor dysfunction? Common issues that we treat, and what does pediatric pelvic floor look like for your kiddo, and then any kind of potty training readiness, and we have some fun tips at the end. Okay, so what is the pelvic floor? If you missed the first couple, let's just kind of go over that briefly. It is made up of 3 layers of muscles, ligaments, and connective tissue, and it basically forms a sling from the pubic bone back to the tailbone and the sacrum. It supports the organs, so bladder, rectum, uterus, prostate, and it plays an essential role for controlling these organs, the bladder and bowels, and sexual function. It also provides stability to the spine and pelvis and helps with maintaining posture and balance. It also works in coordination with the diaphragm, and it manages our intra-abdominal pressure. What's pediatric pelvic health? So what this is we treat kiddos age 0 to 17 for issues related to like pelvic floor muscles as well as the pelvic organs. This is often related to the strength and coordination of these pelvic floor muscles. And a lot of times this tends to be issues related with bladder and bowels, which we're going to dive into more in just a second. And since the bladder and bowels sit really close together in proximity and functioning, the issues often go hand in hand. So a lot of times we'll see some sort of constipation or bowel dysfunction along with some bladder issues. So some common signs of pelvic floor dysfunction, that's going to be constipation, bedwetting, withholding, urinary tract infections, frequency and urgency with voiding, and then fear avoidance from toileting. And we're going to go into each one of these in details on the next slide, kind of give you some ideas of what these look like and signs to look out for with your kiddo. Is a really big one, and you'll hear me talk about it all throughout this whole presentation. About 1 in 20 doctor visits are for children with constipation, and it's pretty common that kiddos complain of stomach aches, belly discomfort, things like that. Constipation is classified as less than 3 bowel movements per week, and it's pretty individualized with each kid. If your kid normally goes every day and all of a sudden they start going, every 3 days, there's probably an issue going on there. They can have regular bowel movements and still be constipated, and this is really tricky. I'll have parents come in and they're like, but my kid has a bowel movement every single day, but maybe they're not fully evacuating the rectum, or maybe their pelvic floor muscles are tight, or maybe they're not sitting on the toilet long enough to let everything come out, and they can still be constipated, so don't let that trick you. And it's usually tight pelvic floor muscles can contribute to constipation. I will also say once your kids become potty trained and we don't sit in the bathroom and watch them go to the bathroom all the time. So sometimes we're unaware of how often they're having a bowel movement or going pee if we're not paying close attention to it, which is totally common and normal. Constipation would be hard stools, stomach discomfort, infrequent bowel movements. And like I mentioned before, that can vary depending on your kiddo. So if you're kind of suspicious of this, I would just say start tracking and see how often they go. Straining with bowel movements and pain with bowel movements. We don't ever want kids to, if you hear them grunting, pushing, straining, if they wipe and there's blood on the toilet paper, anything like that is telling us that they're having a difficult time getting these bowel movements out, and it shouldn't be that difficult or painful for them. So this is a big one. 5 million American children experience nighttime bedwetting, and it's not considered a problem with doctors until the age of 8, although we would like to see you way before that. The leading cause of bedwetting is constipation. So again, here we are with the constipation. Like I said, you'll hear it all night. You'll probably be tired of it soon. But the bladder and bowel sit so closely together. When the rectum is full, it can push onto the bladder. And at night when kids go to bed and they fully relax and these muscles finally relax, the rectum is pushing onto the bladder and can lead to bedwetting. It can also be from tight pelvic floor muscles. Again, if these muscles are tight, when these are usually deep sleepers, they're really relaxed and calm, and then we have the bedwetting. It can start from a really young age, or it can begin spontaneously. Some parents say it never kind of stopped, right? It's when they transitioned out of diapers, and it's common for when you're transitioning out of diapers for it to take longer, even up to a year, for kids not to bedwet at night. But when you notice that it's becoming like an every night occurrence and they're getting older and older and you're still seeing a problem, it's definitely something to look into. Holding. So this is referring to holding in urine or stool for extended periods. It can be either. This is very common in children who are busy and then playing and also attending school. If we're holding in the urine and stool for long periods of time, it can lead to changes in the bladder. So if you're even adults, if we hold our urine in for extended period of times, it can actually overstretch the bladder, and the same thing with the bowels. It leads to these changes, and then these organs can hold more their capacity and not recognize the signals as much of the urgency. It can lead to constipation and further withholding of painful stools. And we see this a lot. It kind of turns into a vicious cycle. Maybe it was a hard stool to begin with, and the kid was fearful of having another hard stool, so they begin to withhold, and then they become further constipated, and then they continue to withhold because it's painful stools, and it kind of leads into this vicious cycle. The signs of withholding are crossing the legs, pee-pee dance. Like some kids will even sit on their heel and put a little pressure on the perineum. Accidents, right? They're holding it and they can't make it to the bathroom. Like all of a sudden it's a 0 to 60. I have to go to the bathroom and I have to get there immediately or I'm not going to make it. And then again, constipation can be another underlying sign of this. Urinary tract infections, 5 to 7% of girls aged 3 to 10 have a UTI, and the reoccurrence rate is really high. They're usually caused by unwanted bacteria that gets into the bladder and the urine. So signs of a UTI would be an increase in urination, painful urination, sudden onset of accidents, and then rare cases, because it's a bacteria, the body can respond to this with fever, nausea, and vomiting. Most of the time, especially in little girls, we see this more often than girls than in boys. They're going to say that it is painful to urinate, and you'll also see all of a sudden they're going to the bathroom like 3 to 4 times an hour, and they have that urgency and a really big increase in urination. Causes of UTIs, withholding urine or withholding stool. So either of the two that we are keeping in longer than we really should is going to increase the risk for bacteria to get in there. The bladder and the bowels are a good way for our body to flush what is in out, and we want to get that out. And when we withhold either of the two, it just increases our risk for bacteria. Constipation is one of the leading causes of UTIs as well, because all of that stool sits in the rectum and the bacteria builds up over time. And then also peeing with the legs crossed. So we want to make sure that our kiddos are sitting and fully relaxing and uncrossing the legs so that they can fully evacuate the bladder. Some tips for prevention is we want to make sure that we are urinating often. It doesn't have to be multiple times in an hour, but every couple hours. Make sure that they're not holding in the urine, especially at school. Kids will go to school and they'll come home to the bathroom, or they're busy at school, or the teachers didn't allow them to pee, and they'll say, I held my pee all day. That's really a sign that that is not good, and we need them to go more often. And we need to manage constipation. Again, another really big underlying issue. If you're seeing a lot of UTIs, I would, tell you to start tracking your kids' stool to see, is constipation an underlying issue here? Proper hydration, right? A lot of our kiddos aren't getting enough water, especially at school. It's really difficult with water fountains and not having access to water all day, but starting to just kind of track and monitor how much water your kid should have. And at the end of this, we're going to talk about what is typical for a day-to-day. And then proper hygiene, right? Teaching, especially girls, how to wipe from front to back, how to keep it clean and dry, especially if we're having accidents. We don't want to sit in our wet undies all day. You want to make sure that this is like a very clean, dry area, because it is kind of like a breeding ground for our bacteria. So frequency and urgency, what this is referring to is an increase in number of urinating. And this can be very frequent, as much as like, at every 10 minutes, they're having to go to the bathroom. That's frequency. Urgency is that sudden, strong urge to urinate. And that's kind of what I was saying, going from that 0 to 60, all of a sudden you have to pee, we're not going to make it to the bathroom. And this could be with urine or even bowels, right? So if your kid is holding it all of a sudden and they're like, the best way to tell is if you're on a road trip and you can't make it to the rest stop, right? Or you can't make it to a bathroom. They should be able to hold it for at least a couple minutes to be able to make it to the bathroom. A common cause of this is overactive bladder syndrome. And so that's where the bladder contracts and it causes that sensation to urinate even when it's not full. And the number one cause of this, again, is constipation. Like I said, I'm seeing a trend. And then by age 4, most kids have control of daytime urination, and age 6, most have control of nighttime. So, do look at these numbers, because I think sometimes we expect our kids at 2 to have, full control over our bladder. It would be nice. But the developmental age for that is actually 4. And like, I said, bedwetting overnight is not super uncommon until age 6. So fear avoidance with toileting. This can be with peeing or pooping or both. It's not uncommon for kiddos to actually pee on the potty but refuse to go poop on the potty. This can start with potty training, or it can begin spontaneously. So some kids, the fear is there from the very beginning. As soon as you start to potty train, other kids, we'll talk about it on the next slide, there's some sort of event or something going on that leads to this fear of the toilet. Common causes. So adult bathrooms, there can be intimidating. Think of the automatic flushers when you're trying to go to the bathroom and it keeps flushing on you, and it terrifies little kiddos. The bathroom seats are really high. They have a hard time getting onto the toilet. And then also strict school schedules. And I kind of mentioned this before, but they're not super inviting to kiddos to go to the bathroom all the time. They, when one kid goes, they all go, and they kind of limit when they can go to the bathroom. And it doesn't really leave a good room for kids to recognize the urgency signals on their own and make their way to the bathroom. Also a history of hard stools or constipation. Again, this is kind of that cycle that we talked about before with withholding. If they have a hard stool or they're constipated and it hurts, they then are fearful to go to the bathroom. Some kiddos will be completely potty trained and they'll demand that their parents put a diaper back on to go poop, because they know that they can like stand and be in a more comfortable position to get the stool out than wanting to sit on the toilet. Also, any sort of traumatic experience on the toilet. And this is what I was leading to before. It doesn't have to be with potty training. It could be something that happened in school or at camp, or, out of your hands that you couldn't control, that was very traumatic for the kid. And all of a sudden now we're seeing this avoidance of using the toilet. Pediatric pelvic therapy and kind of how it can help and what that would look like for kiddos. So pediatric pelvic health therapy is going to address the musculoskeletal impairments. So that's like muscle tightness, muscle weakness, muscle imbalances, as well as the health of the bladder and bowels. So it's really important for us to look how these organs are functioning and how can we optimize the health of these organs, because the pelvic floor muscles are forming that sling and holding them up. And if the bladder and the rectum are full all the time, that's putting a lot of strain on these muscles that could be already tight or weak. We're going to use a combination of behavior and lifestyle modifications. So that's going to be looking at a bladder and bowel diary to see how often are they peeing, how often are they pooping, how much are they drinking, what are they eating. It gives us a really good idea of just the day-to-day function of their organs. It's going to be manual therapies. So that's going to be actually work on the muscles themselves, whether we're lengthening or strengthening those muscles. We can use modalities such as biofeedback, which we're going to talk about. We're going to do exercise. So we're going to make the muscles strong that are weak and lengthen those muscles that we have found to be tight. And it's a lot of education, right, for the parents as well. Some of the first few appointments can actually be spent just with the parents and chatting with the parents and getting a really good feel for what's going on, what are their habits look like, and educating them for, how to sit on the toilet properly and how much water your kids should be drinking. And do we need to manage sometimes supplements? And sometimes with constipation, a big thing that we do is we manage supplements and we help titrate the supplements for them. So we have a lot of kiddos that come to us on Miralax, and parents don't want to be on Miralax forever, and I totally get that. So we have some natural options, and that's really our goal, is to keep it as natural as we can. And so we're going to help them titrate of, what's a natural supplement we can help the kiddo to help them go to the bathroom, to get the rectum back down from being dilated and kind of get to some normal bowel movements. And then some functional retraining of the muscles. So we do a lot of breath work with the kiddos. Diaphragmatic breathing is going to control that pressure within the core canister, which is a big part of our pelvic floor. And that's really going to help with the pressure through the pelvic floor, with utilizing the toilet, and how do we have bowel movements, and how do we kind of control the accessory muscles that are contributing to the tight pelvic floor. What to expect. So the first visit is evaluation, and this is a pretty in-depth conversation. Like I said, it can be spent chatting with parents, or the kiddo can come in and we can look at them. So the evaluation is going to be looking at their history, getting all the details about what's going on, their bladder and bowels, pretty much from birth. We start, from very little. And then we're going to look at their movement. How do they move? What's their body look like? Where are their tight muscles? Where is their weakness? What's their posture? How do they breathe? So it's a lot of in-depth, just information gathering on our end. And then usually the homework that we give you is a bladder and bowel diary. And so at visit 2, what we do is we're going to go over that bladder and bowel habits. We're going to review them, and we're going to optimize these organs for you to the best of our ability. So if it's constipation and we need to look at increasing fiber for food, or do we need to titrate supplements, or do we need to look at water intake, and do we need to go to the bathroom more frequently? A lot of kiddos, especially when they're going to school, they're only, going pee every, 5 or 6 hours, which is really too long. So this is a really great way for us to look at some of those behavior modifications that we can address. And then visit 3 is when we're going to look at the pelvic floor, posture, and breathing, which I kind of mentioned. So pelvic floor in kiddos is all external. There is no internal work done. It simply would be, we look with our eyes and we can see, can the kids contract them? Can they relax them? What does this look like when they're breathing? And if your kiddo doesn't want it to be looked at, totally fine. And we like to build the relationship with them in the first couple of visits. And when they're comfortable and you're comfortable, then we can move on to that. It is not a deal breaker for us. There's plenty that we can work on without it. And then we're going to look at their posture and their breathing assessment. So I had talked about the breathing to manage that core pressure, and that's really key. So a lot of kids and adults don't necessarily breathe the right way with that deep diaphragmatic breath. So we're going to teach them little, small techniques to kind of get that breath work and that manage the pressure under control. Visit 4 is when we're going to introduce biofeedback. We're going to talk about that on the next slide. Again, this is all external, but it's a great way for us to get a look at what those pelvic floor muscles are doing. And then typically we like to do the biofeedback from about visits 4 to 10. So when, the research shows that when you're doing it consistently weekly, that's when you're going to see the biggest changes in these muscles. But also we're going to tie into here like musculoskeletal, we're going to do exercises. A lot of like half of our sessions are pretty much playing with the kids, getting them, they don't know that they're strengthening their core or they're lengthening their muscles. We're going to play lots of games. We're going to do manual therapy. So that's working on any of those muscles. We do a lot of myofascial release, which the fascia is that top layer kind of throughout our body, muscles and organs. And we're able to kind of manually release these, the fascia, which can really make a really big difference, especially Jen and I are both trained in visceral manipulation, which is where we're going to work on the organs themselves externally through the abdominal cavity. And we can go ahead and release some of this fascial restrictions, and that just allows the organs to move a little bit more freely. And kids see really significant changes in their bowel movements with this. And we're also going to review homework, because one of the biggest things we do is we want to educate the parents and make sure that the kids can be successful at home without us. I mean, our goal is not for you to be with us forever. We will be and support you as long as you need. But ultimately, we want you guys to be able to manage this at home. And something that I really like to work on is giving these kids advocacy over their care. A lot of these kids that come to us, they feel defeated. They've been dealing with this for a long time. They're embarrassed and they're ashamed. And so we're really big about making charts, and we kind of call it like the bladder boss chart, and they're in control and they get to make decisions about what they're eating and how much they're drinking, and they get to see how it's really impacting their health. And then they feel a little bit more independent in this, which can be really helpful if it's at a tough age where kids are really looking for that independence. So biofeedback. So we're super excited because we just got this new machine, and it's the EMYO biofeedback system. And what it does is it allows us to see how your kiddo's pelvic floor is functioning, and it lets us look at the muscles around it, accessory muscles. So we're talking about like glutes, the transverse abdominis, which is that deep abdominal layer. And it allows us to visually see the strength and the coordination of these muscles. So how that works is there's external monitors that are placed usually around the external anal sphincter. So it is kind of around the bottom area, but it's all external. And then we'll put one on the glute and one on the abdominals. And then the kids get to play these fun games. And it shows like if they're contracting their muscles, a balloon will go up in the air and it will like collect little points. And then when they relax it, it goes down. So it gives us a really good idea to see, is there a coordination issue? Is it that they're contracting when they should be relaxing and they're relaxing when they should be contracting? Is it an endurance issue where they can, get the muscle up a little bit, but they can't hold it for an extended period of time? Some kiddos we see immediately high tone. So as soon as these are on there, they're already contracting and they can't relax the muscles. So it's hard to visualize these muscles when we don't do any internal work with kiddos. So this gives us a really great idea of what's going on with these muscles. It's completely painless and non-invasive. And I have to say that the kids absolutely love playing these games. So talk about what is normal for your kids as far as like bladder and bowel health. They should be voiding, which is peeing, every 1 to 3 hours. When we're pushing 4 hours, that's a pretty extended amount of time that we're having to contract those pelvic floor muscles and keep that bladder full. Especially with younger kiddos, we really like to see every 1 to 2 hours. Bowel movement, at least 3 per week, and I feel like that's a little on the low end. I would say, some kids it's every day to every other. Like I said, monitor your kid and see what seems to be their normal. If they're going like a week without a bowel movement, definite red flag. If you notice changes of it seems normal and now it's not, definite another red flag. Water intake. This always surprises parents, how much water their kids really need. And it doesn't just have to be water, it can be fluids. It gets a little tricky when we talk about like milk and other things that can contribute to bladder irritation or constipation. But generally, 1 to 3 year old, we're looking at 4 cups, which is 32 ounces. 4 to 8, we're looking at 5 cups, and 8 plus 7 to 8 cups, which adults, they recommend 8. So by 8 plus, they really should be drinking a really good amount of water. This again is difficult to monitor. One, when the kids aren't with us and they're at school, if they don't have a water bottle. And two, it can be difficult when they are out of our hands. Parents will say on the weekend they drink so much, and when they go to school, right, it's out of your hands. So if you can find a water bottle that really clearly marks how much is in there, that can be really helpful and really visual for kids. And then you can say, okay, you know, a 16-ounce water bottle, we need to drink 2 of these throughout the day, right? So it just gives you a really good idea to kind of monitor that a little more. I know we get busy with our kids and we don't pay attention to how much they're drinking and, you know, when they're pooping and peeing and all the things. And then food, this is a really important one. They recommend that like 19 plus grams of fiber for even young kiddos. That's a lot of fiber. And I would say some adults don't even get that much fiber. So, you know, really just trying to increase fruits and vegetables, grains and seeds. You know, there's soluble and insoluble fiber. We want to mix of both. Anything that you can do to kind of make it more fun for kids to eat healthier. And obviously they learn so much by modeling. So the more you can do this, the more your kiddos are going to do it. And you don't always have to kind of harp on them. But also just kind of being aware of how foods affect their body. So some kids, you will find that milk may be constipating for them. It's not every kid. But if you start to notice your kid's a little constipated or they're having a lot of accidents, urinary accidents, kind of monitor what are they eating and drinking. Is there something that's irritating their bladder? Is there something that's contributing to the constipation a little bit more? Food and water play a really big role in the health of these organs. So we're just going to talk about a couple signs for potty training and some tips. This is a really big topic that we talk about with a lot of parents. So some things that your kid might be ready. That's going to be, they can pull up and down their pants during a diaper change. They know the difference between wet and dry. They can sit on the potty very comfortably without fear. Without fear is a really big one. They're not pooping overnight. They're showing interest in the potty. You know, they can have a dry diaper for 1.5 to 2 hours. And then they can kind of communicate the needs for a diaper change. So if your kid's coming to you and saying like, I pooped or I'm wet and they want to change your diaper, that's a great sign. Like they're starting to recognize how their body's working and when things are wet and when they want to be changed. And then having the physical and emotional aspects with that. So, you know, they can, you know, take off their pants and they can help do other things because once they become potty trained, they're pretty independent and pulling on their pants and getting onto the toilet. And then also, you know, extending that time of how long they can hold it. If you're changing a wet diaper every hour, your kiddo's probably not quite ready. So that's something to kind of just keep an eye on. Potty training tips. So the biggest thing is to make it a positive experience. Do not get caught up in the age. So the average age is around 2.5 to 3, but you really have to listen to your kiddo because if you do it too soon, it can really turn into a traumatic experience for the kid and lead to lifelong issues. Maybe not lifelong, but you know, childhood issues. So you want to make sure you're using a potty that's suited for your kid, whether that's a little potty on the floor or that's like a ladder potty that's going up, wherever they're going to feel comfortable. And what I recommend is just bring it out. Just sit it in the bathroom and see, are they interested in it at all? Do they want to sit on it? Do they want to climb on it? Just make it really fun and just kind of casually bring it up. You want to make sure that your kiddo is not constipated. Again, this can start that kind of vicious cycle of withholding and fear avoidance. So if you're already noticing in the diaper really hard stools or your kid's having to like go in the corner and stand and squat and really push hard, there might be some underlying constipation there. Books, which we're going to talk about on the next issue, it's a great way to introduce it, right? How the body works, how you can sit on the potty, how you know when you're ready. That's really great. Don't push it if your kiddo is not interested. Like I said, if you notice any signs of fear and you're really wanting to potty train quickly, especially just kind of take a step back and realize you have to do what's best for your kid or it will end up just being a longer issue than you really hope for. Breathing is super important. So that's that control of that intra-abdominal pressure. So it's great to work on breathing with the kids, which can look like blowing bubbles, blowing a windmill, taking big, deep breaths. It feels very unnatural for kiddos. So anything that you can start doing already, that's kind of controlling that breath, getting a really big breath in with kind of a pursed lipped exhale, like think of blowing bubbles, is a great way to start managing that pressure. Look for the signs of readiness that we already talked about, and then use praise, not punishment. This is a really big one. Kids are really sensitive and they feel shameful, like I said, and we really want to avoid that the most we can. So, you know, even sometimes the word accident, I don't even love the word accident because it makes kids feel really bad about themselves, right? And they're just kind of learning. So using praise can make a world of difference with potty training. These are some of our favorite books that we recommend to kiddos. It's just a great resource. Some of them are for constipation, like It Hurts When I Poop. I Can't No Way is like fear avoidance. I will not get on the toilet. Chewing to pooping, and then the poo-poo potty train is great. It gives a really good idea of like how it works from the moment I put food into my mouth to when poop's coming out. So like, how does the whole digestive system work? It's really cool because kids are actually pretty interested in this. And sometimes I'll even put it next to the potty. And so they're like checking out the potty. They're like checking out these little books. I have a whole setup in the bathroom and they just love it. And then how to poop every day is just a good tips on how to become regular and use the toilet every day. This is a way to find a PT. It's not specific to pediatric PT. And so we kind of have a resource base through who we've been trained to. So if you can't find one in your area, please reach out to us. We're happy to share who we know in the area for you. It's even a more specialty niche than a pelvic PT. There's actually only a couple in the state of Connecticut, but we are so happy to help you find any. We also do virtual. And like I said, sometimes we'll only meet virtually with parents because so much can be done with the education and teaching parents how to do it themselves. And they feel really good about that. So you have different options, but this is just a good database to kind of start to find pelvic rehab practitioners. And then with this, if you decide to book, if you want to work with us, we have a discount. You can use the QR code. Like I said, virtually, in person, whatever works for you, but we're always happy to help you find anybody because we just want to spread the awareness and get you guys the help that you need. My end. Thank you so much. This talks about the next webinars, which I'll let Jen take over. And if you guys have any questions, please feel free to ask them.
Yes, please drop any questions in the chat. I already have a list of questions that people have asked. So next webinar is going to be in August. It's August 8th. It's the second Tuesday, 7 p.m. It's going to be the role of pelvic health for birth. And I just got confirmation that one of my good friends, Dr. Victoria Chamberlain, who is a pediatric and pregnancy postpartum chiropractor, is also going to hop on this one with us. So we're going to kind of like tag team how there are multiple different ways to address preparing for birth. So it's going to be amazing. So keep an eye out all for that marketing that is to come. Now, I think that's the last little. Yes. So now we're moving into questions. So again, if you have questions, please drop them in the chat. Janelle, I have some already that I'm going to just kind of like start reading and then you can respond and then I can add if I choose. But again, please, please, please drop any questions that you guys have in the chat. Okay. So first question that came in, are there more typical times that kids can become constipated? I feel like my daughter really struggled when she started solids.
Yes, that is a really big one because we kind of talked about how food impacts the system. And when they're doing a lot of solids and it's lots of fruits and vegetables, before their system was able to kind of handle that. And now that's like a whole new digestive process that they need to be able to digest these solids. And then we're introducing a lot more foods, right? New foods like dairy and peanut butter and like all the things that can lead to constipation. So if you're kind of noticing that, I would say kind of start to track if you're noticing certain foods are causing this issue, or you think it's kind of just an overall issue, like they're constipated constantly.
How early should we be worried about bedwetting?
Tricky one. Maybe, what do you say? I'd say around 4 to 5 if we're starting to have issues every night, overnight, and you're seeing it to be a continued problem, definitely reach out. Like we said before, 6 is kind of, the overnight. Doctors will say 8. We would like to see you before that. That's definitely an issue before 8. They'll also say it will just resolve on its own. So if you are noticing that this is a really big issue, please touch base with somebody that can help you because The number one cause of bedwetting is actually constipation, and sometimes there's some underlying issues going on that can really resolve these problems.
Totally. And yeah, I'm with you. I'd say 5, like nighttime continence typically by 5. So if you're still noticing stuff by 5 years old and beyond, like it's worth another set of eyes for a practitioner who's maybe doing something different than your pediatrician and who's willing to collaborate with your pediatrician. So yeah, I am totally with you on that. And we do a lot of collab with pediatric GIs, pediatric urology, pediatricians in general, because it is such a multifaceted and the entire family is involved. So we really want to make sure everyone is on the same page. Okay, next question. This one's for directly from the chat. I've been seeing many kids who withhold stool to the point of developing early signs of encopresis, smearing, right? So there's some constipation and then we're having some smearing. For those who are not familiar with encopresis, you're having like leakage almost around the constipated stool. Most of the withholding is due to fear or difficulty reading body signs. How would you approach this in treatment aside from referring the family to a GI specialist?
Yeah, so you're going to have to address the underlying constipation, whether that's with some natural supplements at first. The thing is, when kids are constipated, their rectum is dilated. And when the rectum is dilated, it can hold a lot more stool. And then it also, the urgency signals are diminished. So our goal when kids come in constipated is that we have to get their rectum to go back to its normal size. It can go back to its normal size, but it takes at least a good 6 to 8 months of not being constipated. And that's hard because they'll go to the pediatrician and they'll do a clean out for like 3 days, and then they put them on nothing to continue. And then they just get back to square one. So keeping the rectum empty is one of the biggest things. And also at some point, if the kids are that, constipated, you can do something called a KUB, which is an X-ray of the rectum to see, is there anything hard and impacted? Because when we're having encopresis, it can be that there's something very hard in the rectum and then liquid is leaking around it. So some people will have diarrhea, but they're actually constipated because it's just this like liquid that's kind of leaking around the hard mass. And then addressing tight pelvic floor muscles. So a lot of kiddos with constipation have tight pelvic floor muscles, which could lead to hip tightness, right? We see a lot of adductor, the inner thigh tightness with these kiddos. Some of these kids are anxious. A lot of people with pelvic floor issues tend to be more on that anxious kind of spectrum. So addressing and also then core is a huge one. So what are the mechanics of how they're sitting on the toilet? How are they pushing? And then what's their breath like? Are they holding their breath? We really can utilize that intra-abdominal pressure to help us. And it can also really hurt the pelvic floor. So kind of tackling all of those things is where I would go for treatment.
Cool. So thank you so much. Next question. So this person actually asked the question before you talked about what to expect in the session with pelvic PT. They asked if there was internal work with pediatrics and you said no, so that's already been addressed. The second follow-up to that was, is the parent present while you're in the session, placing the sensors and assessing the pelvic floor? Like, is the parent always around?
Yes, absolutely. The parent is always with you. If when we get to older kids, they're not comfortable and the parent is comfortable, then they don't have to be, but the parent is almost absolutely always present. And if the kids aren't comfortable, I've even let parents place the sensor where I tell them to place it, where I'm not even touching, or the parent's holding the legs up so I can look at the pelvic floor. So we try to make it as comfortable as possible. We know it's not, super fun, but most kids, like I said, we kind of build a nice relationship with them and they feel comfortable with us.
Tina says, great presentation. Which MEO system are you guys using? We have the 200, which is the dual channel system. It's also the hands-free system. So we love this system because we can track, as Janelle was saying, we can look at pelvic floor externally, and then we also can look at other groups of muscles like your transverse abdominis or your glutes. And because these units are literally hands-free, we can look at kids in supine, aka on their back, standing, laying. So I've actually checked somebody in sitting to see if they even have good descent while they're sitting on my table, and we kind of mirror like, okay, what position should you would be doing with the potty, and what's your breath supposed to be doing? So we're able to really look in a functional sense. So we went with the dual channel that is also hands-free, and it has been, for our kids especially, it's really been a game changer. It's just another good tool in our toolbox to be able to kind of like address something that most kids are not connected with. Okay, let's see here. So next question. Oh my goodness. Okay, so, oh, this is a great one. How come we haven't heard of this? Is this a new niche of pediatric PT? My oldest kid has been struggling with constipation, and I feel like it's all consuming in my house.
Yes. Oh my gosh, I totally feel you. And um, it is newer, and kind of the world of pelvic health is becoming bigger and more aware, and more doctors are becoming aware, and more health practitioners are becoming aware that we exist. So there's still very few pediatric pelvic health therapists, unfortunately, but there's a great educator out there who's really trying to spread the word and get us all involved, and that's what we're trying to do here. But yes, it can be consuming thinking about your child's bowel movements all the time. I feel you there. But just keep spreading the word. And would you say it's newer and growing?
Yeah, I would. I mean, here's the thing. Physical therapy as a profession has been around for over 100 years. Pelvic health as a specialty has only been around since like the 70s. And at that point in time, it was only for pregnancy postpartum. And since then, it's like unfolded into all of these like other specialty diagnoses. Pediatrics, I feel like the woman that we're trained through, her name is Dawn. She spearheads through like Herman and Wallace, as well as her own Kids Bladder and Bowel Institute. She's really, I feel like in the last, I don't even know if she said how long she's been doing pediatrics for at least 15 years, but I don't think she's been teaching for that long. So it really is not as well known. And I find because of that, there's a lot of pushback sometimes from referral sources. So like, say you want to try this, you go to your pediatrician's like, I don't know what that is. And so of course your pediatrician doesn't want to refer you somewhere where they're not comfortable or they don't know somebody. Not their fault. I don't want to refer to someone that I don't know either, or some specialty that I'm not familiar with. So I find that can be kind of a catalyst for education of like, hey, this is what this is and this is what we do. But that is still kind of a barrier to care for these kids, it can be really challenging. That's why we have tons of handout, like marketing materials that even we can send to parents to give to the providers, or we can send on their behalf, so that there can at least be a little bit more awareness. Okay, so let's see. Do you recommend purchasing a biofeedback machine for home use? Obviously, it's not the same level as the clinic, but could you do it for home use? That's a good question. I actually got asked this by a parent last week. So here's what I will say. Kids are resilient and they are really smart. And I feel like they learn even faster than adults sometimes. So right now, when I told this mother, I said, I don't think you need to go purchase a biofeedback system, because they can actually be pretty pricey. Even if you're doing the ones that are like, off of Amazon over the counter, they still can be pretty expensive. So I try to figure out a way that we can do it at home with a mirror. So like, can we see it? Can we place 2 stickers like in the same spot? And then can we have the kid watch at a mirror and like have them kind of do biofeedback exercises? Because here's the thing, biofeedback is the umbrella for how your brain connects with your body and how you get that feedback loop. So I try to get a little creative, because also most of the time these kids don't really need a ton of sessions to see change. So I don't typically recommend it right off the bat. If I had somebody who came in with like years and years and years and years, and they did really well on biofeedback and nothing else was working, I probably would put them in touch with a rep or figure out what we could do to get them a biofeedback system at home. But it's just one tool in the toolbox, one facet to the presentation. It's not the whole picture. So I'm always hesitant to send them home with a biofeedback. Would you agree, Janelle?
Yeah, absolutely. And some kids, we don't even do biofeedback and it's not even needed. So again, a tool in the toolbox, not necessarily that you have to have. And there's so many things that we give you that you can do at home that makes such a big difference in the kiddo. And yes, if you can get them to kind of connect with the pelvic floor and see that, that's a great way to do it at home.
Okay, I have one more question. So if anyone else has anything left, drop it in the chat. Last question that I have is any tips for the automatic flush? My kid hates it.
So we will say bring sticky notes with you and
Yes, Post-its.
over the thing. They are horrible. I can't tell you how many times I flush on my kids and they hate it. And then they're like, there's wetness on them and they're like freaking out. And it's so scary. So bring those little Post-it notes, stick them in your purse and just cover it, the little sensor, and then take it off when you're done and it will flush.
100%. That's my favorite one too. Also, you can like put your hand there if you're in the stall with your kiddo, but a Post-it note is like saving grace. So that would be my favorite tip too. So that is all the questions that we have. If you are watching the recording or you come up with something, please shoot us an email. We're happy to kind of like answer any questions and fill in any gaps. And as Janelle said, the database we have is not a public database of people who've taken the coursework. So we are happy to share. So if you have any questions about how to find somebody or somebody local to you, please reach out. And thank you for coming. This was great. And we'll see you guys next month on August 8th for the role of like conservative management for birth prep. Sharing, and let me make sure I stop recording. Have a great